How does each joint of your body move independently of everything else? So if I'm saying to you, I want to look at your neck pain, right? So I want to know, how does your neck articulate in every range of motion? Not just how does your neck move? And how does that play into what you're doing every day in your work? So if I'm at my computer all day, knowing that I get into this position, how does my neck get to be a full joint here, which is separate from these joints over here? Once we articulate that those two are two separate things, then we can allow the body to move in its natural range of motion. So if we look at joint range of motion, which is part of what functional range conditioning is based on, and it's how often are we moving our joints, right? It's not very often at this point. If you look at kids, they're all over the place. They're doing this all the time. And as adults, we're never swinging on monkey bars. My 7-year-old wants to swing on the monkey bars all the time. And I'm like, that looks exhausting to me. But would it be exhausting to me if I use those ranges of motion all of the time? So if I'm using this range of motion, it becomes easier for me when I'm reaching back in my back seat to get something versus having to really struggle to get back there. All we're asking you to do is use your ranges of motion that your body naturally was given to you. So the difference between the therapeutic exercises and the physical therapy is that therapeutic exercises really are just teaching you how to move the joints of your body. Physical therapy is more advanced. Say you're coming in with neck pain from a motor vehicle accident, or I'm asking you to move your neck and I'm looking at you and saying, move your neck in this position, and you get to here and you're like, oh, pain there, right? Now we have something a little bit more complicated going on. So we want to send you over to our physical therapist who's going to give you a full orthopedic exam to say, yes, there's some closing angle pain happening here and this vertebrae is pushing into each other, and now you have a pinched nerve that's happening here running down your arm. So it's a higher level of assessments, a higher level of treatment. And we're probably going to take you from not just global movement exercises to how do we stabilize this part of your neck or your abdomen so that when you're in this position, you're not being crunched into that repeated exercise. We want to take away things that cause pain. And what we do in physical therapy is we do a series of test and retest. So if you go to another therapist, they might, I just had this happened the other day. I was onboarding a new patient as a clinical director, and she said, I'm seeing another physical therapist outside of here. And I said, great. What did that physical therapist give you to do? And she said, well, he gave me this thing, this kind of stretch. And I was like, great. And he gave me this thing where I go back and it really causes me a lot of pain. And I was like, oh, it causes you a lot of pain. Did he tell you not to do that? And she's like, no, he just told me to just go through it. Our big cue is, do we want our body to be in pain? Absolutely not. Even small amounts of pain, it's not appropriate to be in that amount of pain. So really smart patient, she said, I stopped doing that. And I said, great, stop doing that. So on the other end of that, I said, let's give you some snacks, some movements to do so that you can be out of pain. So our big objective in physical therapy is to test when you're in pain. So if I'm saying here, I'm in pain when I do this, I'm going to say, okay, let's try this movement on the other end of that to make it feel better, or a little manual therapy to make it feel better so that the body doesn't have to be in pain all the time. A big proponent of how a body stays in pain once it's in pain is that it keeps in pain. So using breath, using some manual therapy, that's a solution to get you out of pain so that your body gets a break. If your body never gets a break from pain, it doesn't know how to be out of pain. So physical therapy goes beyond just simple movements. It gets into that diagnosis of what is going on at the root of a system and how do we get you out of that pain.